Thanks everybody for being here, and thanks for allowing me to present some of our research and some of the stuff that I've been involved with for the last couple of years. For the purposes of the camera, I'm kind of just going to stay here and be close so that the camera doesn't have to kind of follow me. I typically will move around a lot and kind of just make everybody sick, but I'll try to keep it as confined to this space as much as possible, as much as it pains me. Anyway, so I want to tell you a little bit about high intensity training and how it pertains to health, and how we can incorporate some of this type of training and this type of modality with clinical populations, specifically looking at health, but really trying to dig into how individuals with cardiovascular disease, metabolic disease, pregnancy to some degree, and how that works out. So before we kind of dive into it, we really have to define who is or what is a clinical population. I think I'm going to use two descriptions as they are defined currently. And I'm just going to move through the slides, and some of them, they'll have some fancy stuff, but we'll move right through them. So really the clinical population from a research standpoint is a group of people that we are interested in looking at. Really just looking at understanding what type of individuals are we interested in. So is it individuals with cardiovascular disease, individuals with diabetes, individuals who are women who are pregnant, whatever the case. So what is the group of interest? And that from a research standpoint is always important to design. When you create your projects or you create your study, is who are you interested in studying. However, from a clinical standpoint, from a healthcare standpoint, the definition is very, very sort of cut and simple. It's either people who work with patients and people who don't. So if you are a clinician, that means that you have actually access to a group of individuals. If you're not a clinician, then you're sort of what we would consider support staff. You don't really have direct patient contact. So that's kind of the two definitions that we'll use. And for the purposes of what we are talking about, we're really focusing on the research piece, right? So working with individuals who have clinical conditions or clinical disease, chronic diseases. So what are the recommendations for these individuals? Even though we're focusing on high intensity training, there are recommendations for, as we think of American College of Sports Medicine or the NSCA, whichever sort of body you're interested in, there are recommendations on how to design programs for these individuals. And as you are definitely aware, we know what those risk factors are, right? So we're talking about obesity or overweight or obesity. We're talking about age. We're talking about family history. We're talking about hypertension. We talk about pre-diabetes or history of diabetes. Those are all risk factors that we need to be aware of when we start sort of creating an exercise program, whether it's high intensity or moderate intensity, really doesn't matter. We really want to understand who is the individual that we are working with. So as you work through your exercise program and as you work through your curriculum, you should understand that those guidelines have changed. And whereas before we looked at the profile of the participant to look at how many risk factors they had, and depending on how many risk factors that were classified into low, moderate, or high risk, those guidelines have actually changed. And if you currently have the most up-to-date guidelines, which is the 10th edition, you should see something that is very similar to what you'll see here in a second. And in order to reduce the amount of barriers of individuals to engage in an exercise program, we've kind of gone away with any of those risk factors from a standpoint of kind of categorizing people into low, moderate, or high risk. So the idea is here to kind of create an environment where everybody should exercise. We know that being physically active is more important than being sedentary. And it's more important for someone to do a little bit than not to do anything at all just because they can't get to the doctor to get an exercise test, or they need to get a physical before they start an exercise program. So the idea with the new guideline is to kind of reduce and limit all those barriers and allow people to exercise or be physically active and engage in those programs along the way. So the big sort of picture here, as you can see, this is the new sort of algorithm, if you will, as to how to design or trying to determine who is at risk of cardiovascular disease. This is specifically looking at cardiovascular disease, but it also applies to all clinical populations. So when you look at the entire thing, you see that we're talking about exercise prescription on the top right there. Exercise participation is, do they engage in regular exercise? So do they meet the physical activity guidelines, yes or no? So if they are currently engaged in an exercise program, then you go to one side of the algorithm. If they are not, then you go to the other side of the algorithm. You kind of have to pick depending on how active they currently are. So if we focus on the no side, if they're not engaging in physical activity, then you have to find out, well, what is their medical condition history? Do they have a medical condition that you have to be aware of? So if we go again to the no side, you can look at, so there's no cardiovascular disease, so they are not physically active. And then you go to the next step is, do they have those risk factors that we talked about? Do they have a history of cardiovascular disease? Do they have a history of family history of cardiovascular disease or any other condition? So you kind of go down the algorithm here. So if there's no history of cardiovascular disease, there are no signs or symptoms of cardiovascular disease. So you can see how kind of just looking at what each of the little squares there will dictate kind of how you move through the algorithm. The idea is that you want people to exercise or be physically active regardless of the conditions, right? So even if you have someone who's diabetic, physical activity is still important for them. Physical activity is still beneficial for them, even if it is low-intensity physical activity. So the idea of understanding kind of where they are right now and then how to design those programs to encourage them to continue to be active. So there's no cardiovascular disease, there's no metabolic disease, there's no renal disease, and then you move back and you move down further on the second end there, and then there's no signs and symptoms that suggest that they have cardiovascular disease, right? Because you could ask someone, well, do you have cardiovascular disease? And they say, well, I don't know. What does that mean? Which is very likely. So you have to understand, well, maybe they don't know what cardiovascular disease is, but you start asking questions about their risk factors, and then you figure out, oh, well, but they do have a history of whatever, because their mother or the father or the sister or the brother had early onset of cardiovascular disease. So understanding who the patient is or the individual is going to be important. And then as you follow up, you understand, you look at, do they need a medical clearance? Do they have medical clearance to exercise? So they say that they don't have any kind of cardiovascular disease. They don't have any kind of risk factors for cardiovascular disease. So it is suggested that they probably don't need medical clearance to start. They could start an exercise program. They could start physical activity relatively easy. And then from there, so if they don't have any cardiovascular conditions, they don't have any metabolic disease, they don't have any renal disease, they don't have any risk factors that suggest that is the case, then they could start a light exercise program that it's relatively light, right? So a light exercise program would be, going out for a walk with your dog every day, or getting on the treadmill and walking at a relatively comfortable pace for 10 or 15 minutes, right? So the idea is you could encourage them to be active almost immediately if they don't have a history or if they don't have risk factors for cardiovascular disease or metabolic disease. So on the other end of here, so if you look on the far left, is someone who is not active but doesn't have any disease, right? And then on the third column from the left is someone who's not active but has disease or has risk factors. So you kind of have to follow the model, you kind of have to follow the algorithm as to, well, what should you do next? If you have someone who has cardiovascular disease or they have risk factors of cardiovascular disease, perhaps you encourage light physical activity, but you hold off on those high-intensity interval training programs that you have in mind until you get clearance from a physician, okay? You could have the American College of Sports Medicine recently published actually had a webinar on these guidelines that just came out about a week or so ago. So you could actually watch the entire webinar on your own if you're interested and really spend time dissecting this graph. I just wanted to introduce it here because that has changed and it's something that we need to be aware of so that you are as safe as you possibly be when you start working with an individual who has a clinical condition. All right, so let's talk to the sort of the meat and potatoes of what we want to talk about today, which is high intensity training. All right, so what is high intensity training? You guys probably do it on your own a lot. You probably have done it if you are, if you like to work out, enjoy working out. Maybe you've done it with a friend. Maybe you do it on your own. Maybe you train people currently, and you do it with your clients all the time. But what is high intensity training? We do have some of a vague but specific definition, if you will. So the idea of doing intervals at a higher intensity, but that intensity needs to be at some point where we are able to understand where those intervals happen. So if you look at the second bullet here, the target heart rate, if you will, should be anywhere between 85 to 95% of your peak heart rate measurement. So you have to do, well, for the most part, you should do a maximal effort test to determine what that peak heart rate is. And then from there, you kind of bring that percentages anywhere 85 to 95% of that peak heart rate. Let's say that you don't have the ability to bring someone to the lab, or you are working on your own and you're a personal trainer and you don't have access to a lab to do a peak exercise test. So you could use the RPE scale. Right, so anywhere between 17 to 19, sort of, it's similar to that 85 to 95% of heart rate peak. So you can use that as a measure to understand where your participant or where your client might be. If you look at the graphic here, you want to have multiple intervals, right? You don't want to just do one interval. Most of the studies that I'll show you today have 3 to 4 intervals of very specific time periods, but most of them work in a 4 set intervals, if you will. So you want your first interval to be relatively, yes, high intensity, but at the same time, you want to allow your participant to have a warm-up, and then your first interval may not be, excuse me, may not be the highest interval of it all. So if you see the 4 intervals, the 4th interval of this particular program is actually the highest, right? So it achieves the highest intensity of it all. So the idea is that you allow your client, your participant, to sort of gradually move into these high intensity intervals. All right, so when you look at it from an intensity standpoint, obviously high intensity interval is going to fall within that vigorous category, right? I mean, that makes sense. It's sort of where you want to be. You want to look at that vigorous activity, and then you can see how it sort of it affiliates or associates with all the VO2 values and RPE values that we're familiar with. So this is nothing new. It's just a way of looking at the data relatively different, as well as providing the stimulus for that individual to participate. All right, so why do you even care? All right, why are you guys even here? All right, the idea of high-intensity interval training has, obviously, it's a hot topic, if you will, in exercise physiology these days. And over the last 3 or 5 years, well, I have four years of data here, but it goes even further. Over the last 5 to 10 years, it's been one of those top 10 fitness trends in the industry. And it's sort of fluctuated within those top 10 values, but it's been up on top, on the top 10 at least since 2014 that you can see here. This is all accessible to you, and I'll have throughout. I have the references at the bottom, so you can look at that information as well. All right, so it's a hot topic. All right, but does it work? So what I'm going to do today is I'm going to show you some of these publications that we have access to. I'm not going to show you all the hundreds and hundreds of publications that are available. This is just a graphic to show you that the difference between, if you go to PubMed today, well, this was done in a couple of weeks ago, August 31st. If you were to go to PubMed on August 31st and do exactly what I did there, you have high intensity interval training, and you search for high intensity interval training since 1975. You have a little bit over, say, about 100 articles. If you do the same thing and you put a VO2 max, you could see the big difference between the two types of publications. So the idea is, with this graph, just to tell you that there's a lot of room to do a lot of stuff. So if you are interested in research, high intensity interval training is not only hot in the industry for you to do, as a personal trainer or as a physiologist or whatever the case, but it's also hot in the lab because there's a lot of questions that we still don't have answers to. So if you are interested in research, that's something to consider. All right, so instead of me going over and talking about hundreds and hundreds of articles that tell you just a little bit of a piece of information along the way, and what I've done is I've sort of pulled some of the major articles that look at reviews and meta-analysis and kind of give you the sort of the overall picture of what those articles are. From a research standpoint, a review or meta-analysis is where we're going to get the most information, because they have a conglomerate of articles put together, and then they look at how they may be effective or not effective. So that's kind of sort of what I've chosen to do for this presentation. So we'll start with Dr. Jivala, who is sort of if you are interested in high-intensity interval training, this name has to be as familiar as your own personal name. If you are interested in the topic, Dr. Jivala and his group out of Canada are sort of the leading experts in that area. So a lot of what you'll read will come from his lab, whether it's with him directly or some of his students as well. But in this particular study in 2008, they really looked at metabolic adaptations to both short and long-term high-intensity training, and really looking at, was it worth it? Okay, and if you look at what it's highlighted on there, it was sort of the first time that we understood that high-intensity interval training not only was effective, but it was also, it changed how the body reacted to an exercise session. It changed how, from a metabolic standpoint, it gave us an idea of how metabolic pathways change to this sort of short time period of intensity, which included 30 to 45 seconds of interval. If I were to ask, what is the number one reason why people are not physically active, you will tell me what? Time, right? So here's a type of exercise program, right, that we could do with half the time than what is recommended, yet I can still get you to increase your VO2 max. I can still get you to have improvements in the muscle, in the way how the muscle uptakes glucose. So why wouldn't we do it that? Right? Why wouldn't we use it as a way to combat some of the sedentary behaviors that we currently are experiencing? So if we go back and we continue through sort of the time period, this is another study again from 2015, so a little bit closer to where we are today, time-wise, and looked at improvements in VO2 max. Right? So you guys are all familiar with VO2 max. You understand the chronic adaptations that occur with exercise and how it changes maximal oxygen consumption. So in this case, in this study, they were looking at 28 studies. So of all the studies that had to do with high-intensity interval training, they were able to select 28 randomized and non-randomized controlled trials, and they really looked at the comparison between high-intensity training, moderate continuous training, as well as a control group. So kind of give you an idea of what happened here. So from a meta-analysis standpoint, you kind of put all the studies together, and you look at differences, right? So you look at, if all the studies that looked at VO2 max, you look at the differences between each of the studies and what the groups showed. So what you are seeing here on these graphs is that on your left-hand side, there's a graph that compares high-intensity interval training. I'm sorry, the control group on the left. So if you have the T, the inverted T graph there, on the left-hand side is a control group. On the right side is the endurance training. So when we looked at the meta-analysis data, we looked at the, so if you see here, can't show you, but on the left graphic, inverted T, that big black dot there, it sort of tells us that intervention, when we looked at all the studies comparing control group, sedentary control group, and continuous exercise, for that particular outcome variable, which was VO2 max, it favored endurance training, right? So it makes sense. If you are exercise, you're more likely to have an improvement in VO2 max. All right, so that's not very, that's not significant. It was a significant difference. There was a significance between the two groups, but to you as an exercise physiologist, as a student, that's sort of, you know, that's kind of understood. But if you look on the right side, when you look at control groups, so again, the inverted T, those are all studies that compare high intensity interval training with a control group. Again, you see the diamond dot there. There's also favors high intensity training. What does that suggest? It suggests that when you compare a control group or all the studies that were conducted that had a control group in comparison to a group with high intensity interval training, the high intensity interval training had a significant effect on VO2 max. All right, so that also should make sense because if you're sedentary, you don't expect to have improvements in VO2 max, right? So at the bottom, you can see the differences, right? So the comparison between the control and endurance training group, overall, endurance training had about a 5 milliliters per kg per minute improvement, whereas the high intensity interval training had 5.5 milliliters per kg per minute improvement overall. So now your question should be, well, what happens when you put them both together? Well, I'm glad you asked because I'm going to show you that graph. Okay, and that's what this is. All right, so here's the comparison between what happens when you compare all the studies that looked at high-intensity interval training with continuous moderate exercise. So you can see the black diamond there at the bottom. When you put them all together, the differences are not as significant as they were before when you compare it to a control group. But you could see that the diamond is a little bit further to the right, which favors high-intensity interval training. So this particular study suggested that when you compare control group, when you compare moderate continuous training, and when you compare high-intensity interval training group, the high-intensity interval group does a better or have higher improvements in VO2 max compared to the other two groups. It also suggests that high-intensity interval training has a significant effect at improving cardiovascular conditioning or aerobic conditioning. So from a standpoint of aerobic capacity, high-intensity interval training seems to be more beneficial. More recently, 2017, Carlson looked at how high interval training affects health parameters. And in this particular study, really, they were looking at aerobic intensity and then looking at moderate intensity as well, and then looking at it from a clinical standpoint. So looking at how it compared for individuals who stayed at home and did this program or individuals who actually went to a clinic and did cardiac rehab or something to that effect. So overall, and again, I'm trying to summarize a lot of this data because there's a lot of information, right? So I'm trying to give you sort of, I've done the research, I'm kind of just sharing it with you. So the idea of high-intensity interval training being beneficial for VO2, we just talked a little bit about that. So obviously, it's important. But in this case, we looked at clinical populations. And when we first talked about clinical populations, we talked about whom? Individuals who were sort of grouped together, right? In this study, they looked at cardiovascular populations, so looking at individuals who had cardiovascular disease, people who had heart failure, individuals who had hypertension, they were obese. So these individuals who had chronic conditions and they were performing high-interval training. So we see outside of the typical, 20, 25-year-old individual who we know is able to do high interval training, or we would expect they're able to do high interval training. In this particular study, we were looking at individuals who have clinical conditions. So I think the findings are a little bit more interesting from someone, at least from the standpoint of someone who's interested in cardiac and metabolic diseases. So when we compare to risk factors as well, so high intensity improves risk factors compared to moderate intensity continuous training, so MICT, moderate intensity continuous training. So we're looking at blood pressure, we're looking at HDL. We know that exercise is good for HDL, but what happens with high intensity interval training? Well, we know that also improves HDL as well as body weight. Inflammation, we talk about insulin sensitivity, beta cell function, which is obviously going to be important. And then among everything else, cardiorespiratory fitness, we know it's one of those significant risk factors to attenuate the risk of death, right? So we know that cardiorespiratory is a significant risk factor. So we could improve cardiorespiratory fitness just by doing high-intensity interval training with these types of population as well. So that obviously is important. And then moreover, one of the things that it's reported in this particular study is that the actual structure of the cardiac also changed as a result of the high-intensity interval training. So not only do we have peripheral adaptations that are happening in the musculature, right, where you have improvements in beta cells as well as insulin sensitivity, but there's also seems to be changes that are occurring in the structure of the myocardium that makes that myocardium stronger. And if you go back to your exercise physiology class, it kind of makes sense too. If you have an individual who is completely sedentary and you start them in an exercise program, you see structural changes in the myocardium, right? The myocardium is another muscle, so it's going to strengthen the same way that your biceps or your quads would anyway, right? So you're going to have improvements in stroke volume, the amount of blood that is being ejected from the heart. You're going to have the improvements in stroke volume and ejection fraction and cardiac output. So your heart is going to become more efficient at doing what it's supposed to do. So high intensity interval training seems to have that effect as well. All right, so when we talk about, you know, everybody's interested in obesity, right? Everybody's interested in losing weight. Everybody's interested in overweight and obesity as a way to, or trying to find interventions that will reduce body weight. I personally feel that body weight is sort of a nebulous number, right? It kind of changes, it fluctuates every day. I think there needs to be a better measurement that we should be telling our clients, we should be telling our individuals who we're working with to focus on. The more that you focus on your weight, the more, you know, you're kind of missing the point. You miss the big picture. And I think the emphasis should go to fat-free mass or fat mass, whichever one you want to go. But, you know, getting on a scale every day, every single day for 6 months is not going to tell you anything. You know, because you could be exactly the same body weight, but your body composition changing completely. You could gain more mass, you could gain more fat, whichever way you want to go, but weight, it's not going to give you the whole picture. So to some degree, I think that message needs to be modified as well. So how is high-intensity interval training effective, or is it effective with obesity or overweight population? So we'll talk a little bit about, again, a meta-analysis showing you lots of information in one slide. I know it's kind of a busy slide, but all you have to worry about is looking at that blue arrow. Okay, that's all that matters for you right now. All right, it's understanding the comparison between the groups. So you have a number of studies that have looked at high intensity as a result of VO2 max with overweight individuals. So think of an individual who may be overweight or obese. What happens with exercise? Again, the same thing, if you go back to your exercise physiology days or courses, you expect someone to have improvements in VO2 max, right? But if you are morbidly obese, or overweight, or maybe not even necessarily morbidly obese, but just obese in general, you're going to have a little bit more difficulty. With this, what these studies are showing us here is that, again, the diamond favors high-intensity interval training. So high-intensity interval training seems to be most effective to improve VO2 max among individuals who are overweight or who are obese. Again, if the number one reason or one of the top reasons why people don't exercise is because they don't have time, now we have a type of intervention that could significantly reduce the amount of time that you need to spend exercising, and I'm also going to give you the opportunity to improve your aerobic capacity. That may be something to consider to maximize your efforts. So the important piece for morbidly obese or obese individuals is decreasing body fat, right? So we want to have those interventions that decrease body fat, that improve fat-free mass, and change and modify body composition. So now the tree, your inverted T tree here, and you look at your diamond, it's on the opposite end, right? Before it was on the right side of the inverted T, now it's on the left side. But notice what are the variables at the bottom, okay? Favors high-intensity interval training or favors traditional training. So in this case, you're looking at body fat. So you want that decrease in body fat compared to a traditional exercise. So high-intensity interval training seems to be more effective at improving aerobic capacity, VO2 max, as well as decreasing body fat. Okay, so that's kind of what you want. If you have an individual who is obese or overweight, you want them to have these benefits. All right, so we have improvements in aerobic capacity, we have improvements in body fat. Let's talk about quality of life. All right, so ultimately you would think that if you have improvements in aerobic capacity, you would have improvements in quality of life. If you have improvements in body composition, technically you would say that you would have also, you could potentially have improvements in quality of life, but we have to look at the data, all right? And this particular study, again, relatively new study, also look at exactly that. So we're looking at high-intensity interval training as a measure of improving or looking at improvements in quality of life in individuals with coronary artery disease who whether they have a heart attack or they've had bypass surgery or they've had a stent or they have any kind of coronary condition, which are clinical populations. So again, we have the same sort of graph here. You have those inverted T graphs, these little trees, and we're looking at that diamond piece, okay? Sort of looking at that black diamond to understand what is happening. Top panel, it's an overall, right? So looking at how all the studies looked and compare the high-intensity interval training versus the continuous training group. And again, it favors high-intensity interval training. So almost every single study that I'll show you, it kind of has the same feel. It always favors high-intensity interval training. So the top panel is aerobic overall, all the studies that were looked in this particular study. The difference in this particular systematic review is that they compare the two groups that had different changes in caloric intake. So we know that caloric intake is important when you're designing an exercise program, right? Especially if you want to lose weight, if you want to have any changes in body composition. So the middle graph here is those studies that only looked at differences in oxygen consumption. This is VO2 measurement. That looked at VO2 in the studies that did not control for diet. All right, so if you don't control for diet, in this case, you see that your diamond, your black diamond, there's more to the right than it was up on top. But if you control for diet, which is the bottom here, the bottom panel here, that black diamond kind of goes into sort of the zero marker as if there's no significant differences. Okay, so there's something that it's happening with diet, right? Caloric intake. And we know that to be the case when we look at interventions that control for diet and those who don't. Typically, those who control for diet may do better or not, depending on what the diets are like. But you have to take into consideration what that diet is. Okay, so that's kind of what this is telling us here. So this is aerobic capacity overall. When you move on and look at some of the quality of life factors, and this is kind of small, you really can't see that. But you could see how, the diamond is much wider, right? So you have the length of the diamond is much larger. So it's not a clear difference that we could see. And then it sort of moves around the zero marker. So what that tells us is that we don't really understand I mean, there may be differences, right? Because there may be to the right or to the left of that inverter T. So it favors high intensity interval training or continuous training, but it's not clear. So we don't really have, from a standpoint of from a quality of life standpoint, from psychological factors, from motivational factors that affect quality of life, that distinction is not clear yet, at least with individuals with cardiovascular disease. We have some data to support and sort of dispute some of this data, but I can't tell you about that just yet. So let's talk about glucose. Let's talk about diabetes. Obviously, we talk about cardiovascular disease. We believe and we think that diabetes is an equivalent to cardiovascular disease. So, you know, all the literature that tells you that, you know, if you have diabetes, you're more likely or you have cardiovascular disease. So in this case, I love this man, Jellyman, in a recent study in 2015 looked at high-intensity interval training among diabetics, looking at beta cells and looking at insulin sensitivity. So I'll give you a little bit of sort of, to change it up a little bit, if you will, kind of how the study came about. They looked at, if you look at the top number, they looked about over 6,000 studies that had something to do with high-intensity interval training or training and that effect. And that's how they developed this review and meta-analysis. So you find as many articles you can in the topic that are relevant to your question, and you kind of just start cutting them down based on what you're looking for. I was hoping that this could be seen better, but these are the findings. So they look at, again, same style of information that we've been looking at throughout the entire time. In this case, you kind of have a zero marker, and it tells you how it moves either right or left, depending on what it favors, whether high-intensity interval training or moderate intensity. So you can see in the top left, you have insulin changes in insulin resistance after high-intensity interval training. Most of the studies are on the left-hand side, which favor high-intensity interval training, telling you that high-intensity interval training has a significant effect. In every study that they looked at, high-intensity interval training had a larger effect on insulin sensitivity than compared to continuous exercise. The same thing is true for fasting glucose after high-intensity interval training compared to continuous training. And I'll share this with Dr. Pudavine later, so you could actually have the slides and you could see some of these numbers, okay? That will be easier for you to look at. And then the same thing with insulin resistance. Insulin resistance, the numbers are not as clear as perhaps VO2 max, okay? There's a lot of factors that go along that may impact insulin resistance, insulin sensitivity, and it really has to deal with, potentially, in my opinion, that has to do with the length of training. So, you know, how long were these people training for? Is it just 2, 3, 4, 5, 6, 7 weeks? It may not be long enough, even though that they were doing that high-intensity interval training. Okay, so again, something to consider. But we do see high-intensity interval training being slightly more effective than continuous training in this type of population as well. All right, so one of the questions that as I was sort of putting this together, Dr. Pudavine wanted me to include clinical populations overall. One of the two things that were the hardest to find was both cancer as well as in pregnancy, and we'll talk a little bit about that. But in this particular study, they were looking at cancer survivors, breast cancer survivors, and really look at high-intensity functional training, which is a little bit different than high-intensity interval training, but it was kind of the one article that I was able to find that kind of provided a good overall picture, both from a physical standpoint as well as, to some degree, psychological variables. So in this case, this is a regular study. They looked at, I believe our sample it's 6 individuals. These are all women who were survivors of breast cancer, and they did 5 weeks of high-intensity functional training, which basically is a combination of resistance training and aerobic training using multifunctional or large muscle groups and using functional exercises. As you can see there, the first table right here at the top here, you're looking at functional scales, so looking at that social component. So in this group of women, that social environment of being together and having this sort of class, if you will, whether in this case it was high intensity functional training, but in this class environment had a significant effect on that social piece. So how they felt about being around other people. Okay, so that may be important not only from an adherence standpoint, but also from an enjoyment standpoint. Right? Most people are going to do that of what they enjoy. If they don't enjoy exercise, guess what? It doesn't matter what your program says. It doesn't matter how good your program is. If they don't enjoy it, they're not going to do it. Okay, so that social piece, working in groups, in this case, seem to have had an impact. And then obviously at the bottom here, you have changes in lean mass, fat mass, and body fat percentages, even if you didn't have a significant change in body weight. Again, it goes back to my original point that body weight may be completely insignificant if we're able to modify body composition. If you're able to increase lean muscle mass, then why should we care about body weight? It really doesn't matter, okay? And I have a little bit of a sore spot with that because when you look at just height and weight, my BMI is 31.3, which puts me in a morbidly obese category, right? Or puts me in an obese category. Well, let's go deeper than that. Let's just go a little bit deeper than just looking at height and weight overall. And then here is from a functional standpoint, right? So if we look at functional ability, we're looking at individuals who have cancer, who may be limited to what they're able to do because of their treatments, the past treatments, or weaknesses as a result of their condition. So when you look at functional changes, even after 5 weeks of high-intensity functional training, you can see how those markers have changed over time. 5 weeks is not a long period of time, and these women were only coming 2 or 3 days a week to train. So relatively small time commitment for a significant improvement in quality of life. Okay, so something to consider. So I've told you a lot about the research that is out there. I can't tell you a lot about this because it's under review right now. We just finished this particular study. This has to deal with women who are pregnant and are undergo what we consider, CrossFit training. Okay, so our lab is primarily interested in CrossFit training as a modality of high intensity function or high intensity interval training, or high intensity training, I should say. So really looking at how CrossFit training is not only different, but how people may perceive or utilize this type of training modality to the benefit, and physiologically what changes. So in this particular study, we interviewed, I forget the total numbers, but I think it was somewhere in the neighborhood about 25, 30 women who were currently pregnant. So they were pregnant and they were undergoing high-intensity interval, CrossFit training. And overall, what I'll tell you is that the themes that came about from these interviews was that for them, while they were pregnant, CrossFit resulted in 5 themes, and you can see those themes there. So they looked at quitting not being an option. So even though that they, most people told them they were crazy. Let's just kind of put it the way that it was. Most people told them that while they were pregnant, they should have been doing this type of training. For them, quitting wasn't an option. So they were going to continue doing what they were doing during the pregnancy and modify whatever work they were doing to be able to accomplish whatever the goal was, which was to remain active. The second one was that supporting the community. They felt that the community that they were a part of with that particular training program was supportive enough of them to continue to do what they were doing, and that was helpful for them during the time. Obviously, listening to the bodies and modifying their workouts was important, and it was necessary because, especially as they got a little bit more advanced in the pregnancy, that was part of how they modified the programs and kind of were able to do what they were doing. And then they felt empowered and they had pride in what they were doing, just from the standpoint of, people will see them both in the gyms, they're in the streets, and they would say, oh, I participate in this type of training modality, and people were like, people were giving them, kudos for continuing their exercise program amidst of, being pregnant. So that kind of felt, that they felt empowered by that. And then they also felt that both the delivery and the pregnancy overall was a little bit easier because they were remaining active, because they were stronger, and because they were doing this type of training throughout the entire pregnancy. And then obviously from a lifestyle and functionality post-baby, they felt that by maintaining their training, although modified, by maintaining this training, they were able to be better at life after pregnancy, if you will, as a result. So again, this is all on the review that really wanted to kind of get an idea of how this high intensity interval training affects individuals or women who are pregnant. We don't have hard data that I could come here and tell you, here's a study that looked at pregnant women that have been participating in high intensity interval training because they're hard to do, they take a long time. And a lot of the times the RRB will probably have a really big issue with the population. So, we're working through it. We're trying to find a way to try to incorporate some of that. But I do have some data to show you. Obviously we typically have to do the animal model before we're able to bring it to the human model, if you will. So this is a study I found that looked at rats and how they how they reacted to high intensity interval training, specifically looking at in a treadmill. So they had 4 groups. They had a group that was sedentary, and then a group that performed high intensity interval training. Then they mated the rats, and then while they were pregnant, they had a sedentary group, they had a high intensity group, and then a continuous training group during pregnancy. So the results of that study are there. So again, this is not the same population, right? We can't say, well, it was okay for the rat population, so we're going to do the same thing for the humans. But it provides a good suggestion, or at least provides some data to suggest that could potentially have implications for women during exercise. We definitely know that exercise is good during pregnancy. We definitely know that moderate intensity exercise is good during pregnancy. We did not have any in the previous study that I told you about, the women doing CrossFit training. We did not have any events related to their training with those women, so it was safe for them. So again, we need further research to look at some of these differences. All right, so from a program design standpoint, with the stuff that you guys are probably more interested in, if you will. So we know that high intensity training is beneficial, right? We know all these benefits of high intensity training. We talked about VO2, we talked about peripheral adaptations, we talked about changes among cardiac patients and that sort of thing. So the idea of safety, we just kind of touched upon a little bit. There really isn't any one study in the literature today that tells us that high intensity interval training is more dangerous than what we are currently doing. Whether you're talking about clinical populations, whether you're talking about individuals with cardiovascular disease, individuals with diabetes, individuals with pulmonary disease, any kind of clinical condition. Of course, you have to be aware of who your patient is, and you have to modify your training based on your individual's capabilities. So you can't take an athlete and do the same thing with an aerobic or a cardiac patient. But you're definitely able to some degree, do high-intensity interval training. There are some contraindications that you need to be aware of, and these are specific to individuals with cardiovascular disease, someone who had a recent heart attack, someone who had an angioplasty or a stent, bypass surgery. Those are things that you obviously have to be aware of. But as long as you have someone who is relatively healthy and really doesn't have any signs and symptoms, they can start the exercise program. The hard part with high-intensity interval training is that there's a lot of factors to consider when you design a program. Not only is it, well, you know, these many reps, these many sets, but you also have to think about the resting periods, how many intervals you're going to do, how long are your intervals going to do, how long is your resting session going to be in between intervals. So you kind of have to dig in a little bit as to what your goal is. It's kind of hard for me to tell you how to design a program without knowing what the ultimate goal is going to be for your participant. But I'll give you some examples. So if you're looking at doing a training program that is relatively short intervals, you want to kind of look at that intensity as high as possible. So 100 plus, 105, 110, right? These are very short intervals. You're looking at, you know, intervals of 10 to 60 seconds. Of course, if you're working with your 65-year-old grandma, this is probably not the place where you want to start, right? You probably want to start a little bit lower and kind of just gradually get up there. But if you're working with an athlete who is used to doing some of this stuff, then it shouldn't be an issue at all. Total volume of the entire session, anywhere between 10 to 15 minutes. Okay? If you're looking at more of a long interval, your intensities may be a little bit lower, but your intervals are a little bit longer, both the work interval as well as your rest interval. And that's probably where you want to start with someone who is unaccustomed to doing this type of training. So start with a longer session and then kind of gradually condense it as you move along. An example of this is here. And you can't really see this, but you'll be able to see it later on. This is a printout of all the studies that the Jellyman et al. Looked at. That's a study that looked at the diabetic population. In this study, if you look at those numbers, you could see that every single study had different volumes, had different time intervals, had different work percentages. So they were all different. So it's really hard for me to say, okay, well, you should just do this. Okay? The best I can do is going to give you this recommendation, because ultimately we can't have this cookie cutter approach to an exercise prescription, whether it is high intensity interval or not. You should always personalize and individualize the exercise prescription to your individual, to your participant. What is the goal that you're trying to achieve ultimately? And as you move forward, I will leave you with that high intensity is always relative. It's relative to what you are able to do. It's relative to what your client, your participant, the individual who you're working with is able to do. Remember, it's a percent of their peak. It's not a percent of your peak. It's not a percent of your goal. All right? Your goals are maybe different than mine. You know, if you're in your 20s, your maximum heart rate is 200, mine may be 150. Well, 85% of 200 and 85% of 150 are totally different numbers. In this example, I give you an Olympic athlete on the right, or the red color on the top, and then a coronary heart disease patient on the bottom in blue. Notice that they're working at the same relative intensity. They're still doing interval training. The Olympic athlete's working at a much higher percentage of their capacity compared to the heart patient, but they're still working at the same relative intensity, 85, 95%. Okay? So understanding that, again, that's probably the number one thing. It's high intensity is relative to your individual. A couple things additionally to consider, really trying to understand, you know, maintaining those intervals, maintaining the workload over the period of time of work. It's going to be important. How do you know what is good? Well, if you're not able to do multiple intervals, like I said, originally most of the work has been done with 4 sets of 4 minutes as sort of the intervals, if you will. So if you're not able to do a 5th interval, then the intensity may be too hard. If you're able to do 4, 5, 6, 7, then the interval, the workload on those intervals is not hard enough. So it's kind of similar to using the talk test, right? So if you're able to do it, that's great. If you're not, then you're not working hard enough. And then your recovery piece, that's probably the hardest part of it all, is if you have a 3-minute recovery period or just in general 3 minutes, but you could do less obviously. But if you have an exercise, a recovery period that you're not able to recover, if your participant is not able to recover fast enough between intervals, then your rest period is not long enough, right? If they're not able to do one work interval and then you have a rest period, and that rest period doesn't provide enough of a rest that they can't do the second interval, then that rest period is just not long enough, all right? And then obviously conversely, how do you know if it's too long? Well, they're able to perform near maximum or even more than what they're able to do, then that resting period may be too long. So really understanding what those numbers are and what that time period is, it's going to be important. I'll leave you with this graph, if you will. Kind of just, you got to find, high intensity training is going to be on sort of the middle of the spectrum, right? So if you want to train for a marathon, you got to do those long runs. You got to go out and do those 25, 26 miles and feel what that feels like. If you want to be a bodybuilder, then you got to spend time in the weight room, right? So high intensity interval training could give you a little bit of both and reduce the amount of time that you experience training for either one of those two. So sort of in the middle, you really have to find what is the goal of the activity. There is a place for high intensity interval training if you are training for a marathon, right? But it may not be the majority of your training. So you could sort of interspread that interval training within your training program, but you're going to have to do those long training runs. And then the same thing for if you're trying to increase muscle mass, then you could interspread some of those high intensity interval training programs along the way to change it up a little bit. I'm going to skip this slide. And then as a conclusion slide, if you will, I'll tell you that, if considering that about 20% of the population meets the physical activity guidelines, consider high intensity interval training as a way to sort of educate and incorporate it into a training program for people to begin to participate in a training modality that of their liking, but try to engage them in something that may be interesting and different, other than going on the treadmill and walk for 30, 50, 40 minutes that we know really it's not working. So with that, I appreciate the invitation. I thank you for being here, and I'll take questions.
Do you have any questions?
Yes.
Okay, I have a couple.
Okay, shoot.
So my first question is, you talked about the high intensity interval training. It's good for patients with obesity issues, hypertension, and just overall general weight loss. So what about a patient who, well, not even a patient, I say a client that wants to weight gain, they want to gain muscle? Would you encourage high intensity interval training?
Yeah, I mean, I think that it's definitely doable. I think it's definitely going to be, it should be part of that if your training program, but it shouldn't really be the sole way of training. You have to have those hypertrophy days. You have to have those days where you're encouraging, you're utilizing, and you're using those, hypertrophy type models to train for hypertrophy. You could include interval training within those protocols just to be able to kind of change it up, if you will. But you can't just do, I mean, we saw that with, what's that?
You can't rely on it.
You could definitely rely on it, but it's going to take more if you really were looking at increasing muscle mass from a, you know, and I'm talking about, who are we talking about? We're talking about a general individual, you know, a 45-year-old grandma or mom who hasn't done anything over the last 20 years, maybe since high school and things like that. If you do high intensity training, you're going to have some of those changes, right? But if you're looking at somebody who's more on the advanced end, then you have to be a little more specific with your training. So it really depends on who you're talking about. General population, 100% yes. And it's sort of a result, if you have someone who loses body fat, more than likely is because they're gaining muscle mass, right?
Okay, the second question I have was, so with a patient who does have hypertension and is obese, when do you start, if you want to use that as far as maybe the type of program you're trying to set up for them, when do you start high intensity interval training?
So well, you can start them, I mean, how long have they been exercising?
So let's say they were in a extreme sedentary
Okay. So remember, when we talk about high intensity interval training, it's relative, right? So, I mean, you could have them start walking, and within their, let's say that you go out for a walk with them, okay? You guys have a pretty nice lake around here, so let's say that, I'm using that as an example. Let's say that you're walking for 20 minutes, and they haven't done anything in their lives until, you know, maybe they did it in high school and now here you are, right? And it seems like you have a specific person in mind. So the idea of high intensity is it's completely relative. So you could go out for a walk for 20 minutes and every 30 seconds, you're gonna pick up your pace. And then you're gonna bring it back down to a normal, comfortable place. So, you know, you could get as creative as you want. You could use your heart rate monitor, you could use the Fitbit, you could use whatever you want. Simply, you could just use the talk test. If you could have a conversation with them during the first 30 seconds, that's great. That's a moderate intensity. But then they shouldn't be able to carry on that conversation during the high intensity interval session. Does that make sense? So you alternate back and forth. So I think you could start tomorrow if you wanted to. I bet obviously it's hard for me to tell you exactly because I don't know the patient, I don't know their medical history, but you obviously do. You seem like you do. So the idea of you could start incorporating high intensity training at any point in time. You just have to be smart as to how you incorporate it. You're not going to get them on the treadmill and have them run at 10 miles an hour for 30-second intervals, right? But you could have them walk faster than what they're used to. That's still high intensity for them. It may not be for you, but it is for them. Does that make sense?
Yeah.
Okay? Good. Yes, sir.
I noticed on one of the charts that the data showed that high intensity, the HIIT was, I guess, not as effective in those who were changing their diet as compared to those who were not changing their diet.
Yep.
What would be a reason for that?
It's hard for me to sort of speculate based on the data that they showed. We do know that some of the studies that have a more controlled environment technically do better than most when you don't. And that's just, I think, again, I can't really talk about what the study that they did, but I think if you're in an environment where you have that control of the diet, you may or may not see differences. In this particular case, I can't tell you exactly why that was the case. Yes.
I'm not heavy into the HIIT literature, but you had PGC1 alpha on there as a response. Was that pretty comparable to endurance training, or?
I'll have to go back and really look at the comparisons between the two. I would try to look at an overview of the literature, not specifically markers, but I was curious.
Yeah. I didn't know if it, if you start manipulating the rest times and stuff, you have a greater response. I know they've done some resistance training in volume equated, but at different intensities. But you're talking about one exercise,
right?
Exercise versus sessions. So.
Right.
Okay.
Yeah, but I mean, that's a good point. I mean, looking at how from an enzymatic standpoint, how from a receptor standpoint, what changes depending on, and and it's hard to do because there's so many variables, and if you look at that chart, the time periods and the intervals are all over the place. There really isn't, unless you're doing like a Tabata or something to that effect where it's all the same, everything seems to be different. So it's kind of hard to say, well, this is the protocol that you should do, or this is the intensity that you should be doing. It's really hard to say it. For the most part, we know that it works, if you will, whether it's general population or a clinical type of population. Which is good, right? So we could minimize the amount of time spent doing the intensity of the work, and if we could cut it in half, well, maybe people will be more likely to engage in the type of training. No other questions? Yeah.
So would the HIIT program be more effective than the resistance type program because of on hypertension clients because of some fact? I know when you're doing resistance training, I think eccentric phase is like when you're at higher chance of hypertension. So would you say is more effective?
That's a really good point. Based on what we have, we really can't. I can't really tell you, just based on the concentric or eccentric phase of the movement. You kind of have to look at the entire picture, right? You have to look at the entire prescription. Based on what we have for those individuals who are hypertensive, it seems that high intensity interval training is effective way of reducing high blood pressure, but it's kind of hard to say. When you compare it, remember that the comparisons were all done with moderate intensity, continuous exercise. So we don't have resistance training in there. So it's kind of hard for me to tell you, well, resistance training or HIIT is better than one or the other. The comparison is with moderate intensities, continuous training, which is where we know that, if you look at the physical activity guidelines, that's what has the largest impact in blood pressure response, right? Yes, we do know that resistance training has an effect in blood pressure, but to compare the two, I can't give you that answer because I don't know. Okay, but it's definitely a good a good project or something to keep in mind so that we could compare how does that differ, right? A resistance training program, a controlled resistance training program versus a HIIT type of training. You're looking at two different modalities, but what is the effect on the two? Maybe looking at body composition or oxygen consumption, whatever the case may be. I think that's definitely doable, and it's interesting. It would be very, very interesting to do. Thank you, guys. Sorry it took a little bit longer than. Thank you.